This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
We see a lot of cellulitis. We kind of evaluate patients, usually start them on antibiotics, discharge them home. But one of the things that's kind of important is setting their expectations, and cellulitis probably doesn't get better that quickly. So there was a recent study that actually looked at this where they followed patients who were treated and diagnosed after being treated for cellulitis for about 2 weeks. And they followed them at 3 days, 7 days, 14 days. And at 3 days, there was hardly any improvement in any of them. They still had, almost all of them still had the redness, the warmth, the pain. Towards 7 days, they started to get better. And by 14 days, only about half of the patients thought they were all better. They still had redness. They still had some swelling. So it doesn't mean that those are necessarily treatment failures. And I think it's real important to tell patients, even like when we draw a circle, it might get a little worse. It's definitely going to take time for that redness to get better. And if they're not having high fevers and the pain's not getting worse, they don't all need to come back right away for a recheck. We should definitely set them up to know that it's going to take time for this to get better, even being on the right antibiotics. Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.